a lot of obstacles in the way. So again, it's nice to have these people coherent enough to be able to guide themselves out. Working in this environment, typically, if you don't have the ability to manage yourself like that, you end up doing a lot of tagline work to try to keep positioned off those obstacles. This works out nice.
2 minutes, Cap.
Looks like almost 2/3 of the lift with one stroke of their system, so they were really close. But not a bad idea. One full pull and then one, looks like one reset gets them completely over the edge. The nice thing here is that this haul team is standing in one position. We try to really discourage people walking with the rope because you stand the possibility of a trip hazard. So if you stand in place, and that hand-over-hand action that they were doing works out really well for a haul team. Well, I think anytime you deal with a Stokes basket, that's probably one of the more maybe involved patient packaging devices that you're going to deal with. You had two-person entry. You definitely have a lot of obstacles, and you have some questionable anchors to deal with. So yeah, it makes it an involved scenario. I think it's something that takes a well-trained team to tackle that, handle it safely. Those guys took a real nice approach to it. Clean rigging, real simple setup on the Stokes basket, and 2 people in and out quick. It looked nice. Having the high point is definitely a saving grace for them.
If we're going to do scenarios, as much realism as we can give them is going to make it better. Okay? I personally, when I run scenarios, and that's why this afternoon at the competition you're going to be running around places, because I like to put it where it may have happened. You know, obviously we can only go so far in scenarios. Okay? But when I'm back home and I'm doing things for my classes, if I want a school shooting, I call up Gary and I have students running around the hallway in the school. If I want a car accident and I want to bleed, I've got an IV pump and I've got, everything hooked up, so I got spurting blood. Because sometimes you need to have that realism to really make it sit.
The International Rescue and Emergency Care Association also hosts competition for the best EMS performance. Here is a typical basic life support scenario.
Okay. So you are dispatched to an accident involving a 10-year-old. Okay. That's it.
That's it. Scene safe, BSI, ALSPD, fire department, squad truck, helicopter, 2nd BLS unit. Any visible hazards?
None.
Cars running or off?
Off.
All right. No other injuries or another injury? All right. Oh, okay. Why did you run out? Why didn't you tell me what happened? Somebody help him.
Come on here.
No. I hit him. He ran right out. Respiration?
He is breathing.
I don't want to get in my car.
Longer breathing 15 liters per minute.
Okay, well, he ran right out in front of my car. Ceasefire maintained. I hit him. Go ahead and flew over there. And he landed right there.
You find blood behind the head.
You just do something for him.
I see no blood. I'm going to start with RTA.
You
with my hand. I've got
you
blood
find
behind
blood
the
behind the
head.
head. You find
Are
abrasions
you
on the elbows. And
Hey, is it? Now the blood is
Where's
controlled with my hand.
It's controlled with direct pressure.
Hey, controlled direct pressure. I do have ceasefire. Is he responsive to painful stimuli?
He's conscious.
Come back here.
Okay,
Okay, I'm going to start with an RTA.
All right.
Ears, nose, and throats. I see nothing coming out of ears, nose, and mouth. Hey, buddy, can you hear me?
He can hear you. Pupils are curled.
Okay.
Can you also get her and make
No
sure, ma'am,
JVD, no jugular.
None.
Wait, put this collar on my house. All right, so we're going to go ahead and put a C collar on. We're measure from the top of the shoulder to the bottom of the jaw. Yep, go ahead.
No,
Right here.
he ran right out.
I know he did, but I'm going to find out.
Does anybody know who
jumped
he
on
is?
the car.
His name
he
is
landed
Jared.
right there.
I know.
His name is Jared. Do we have an age on him?
He's 10.
Please.
Paradoxal movement.
Right-sided bruising on the chest.
Right side bruising.
Hey, are you all right, my boy?
We do have pulses.
Hey,
Hold that. Hold
how
that.
come you ran out?
Step aside for a
How
minute.
come you ran
Step
out in
aside.
front of me?
I
Do you
need.
hear it?
Hey, Cromer.
Soft.
Man, do we have a
Pelvis.
police here?
Tender.
Hey.
Pelvis stable.
Can you have a seat?
You take care of him.
We
No,
are.
I
Sure,
don't
we'll have
know.
a seat in your car. All right, we're checking.
I just hear him.
Sir,
We've got no.
if you can hear me,
checking
wiggle
for
your toes.
You're the right-sided femur deformity.
We are. You just right side femur deformity is it?
No, it's closed.
Okay.
We've got. All right, so we're
He
checking
shouldn't
for
be running
presence.
around like that.
Can you hear me? Wiggle your toes. Wiggle, wiggle, wiggle.
You can wiggle.
I see nothing
Is
on
there
the
a
elbows,
bystander here, anybody that can be with this
abrasions.
person?
I do have
in the car?
pulses.
Ran right out in front
I have
of
good
me.
pulses. pulses. They're equal. Go ahead, squeeze.
Pulses are present.
Squeeze. Yep. Wiggle your fingers. Yep.
You can wiggle through.
Okay, can you feel that? Can you talk to me?
Yes.
Does he talk to me?
Yes.
Hey, I need a 4x4 for his head, please.
Oh, dear.
And then we're gonna go ahead. I've got the chest. We're gonna go ahead and.
No, I want
As soon as we're done, we'll take this side to the unaffected
Let me
side.
out of here.
We do have.
Get your fat rump out of here.
No, ma'am.
I want out.
We're gonna go
Stay
ahead
right
a
there.
bandage on his injury.
You're
and
gonna
we're
get
gonna
tired.
go
You're
ahead
gonna
and
get
tape
mad
it
at
down.
me, but you
Yes.
stay right there.
No, I want to go by.
No, you're not. You just stay right
Can we
there.
go ahead and get on the horn and get
Do we
police
have
out here,
anybody on
expedite
the
them?
scene?
Yes, we do.
All right, so can police detain her?
No.
They can't keep her calm.
Let me have them keys. Ain't no
Let's
keys
get a
in there.
fire department here. Let them detain her.
All right.
The police can't do anything. We got fracture too, femur fracture.
Here, you're gonna get tired out, lady.
Okay, we took his shirt off.
Yes.
We got him completely exposed. There was no blood found. Other
He
than
shouldn't
the
have been
injury.
running out of the road.
He is he
Where's
alert?
his parents?
He's alert.
Where's his parents?
We'll find him in a minute.
No.
All right, well.
Why
he's
was
alert.
he running
So we're
out
gonna
the
ask-
road?
All right, so we're taping his
parents
injured
around
side
or
to his
anything.
unaffected side
Yep.
to make sure that we've
Hey, did you
stabilized
call
his
the
first step.
ambulance? Did you call the
Yeah, we
ambulance?
are the ambulance.
Where are they?
Yeah, we got a calling card.
We still have good
Who
airway.
called you?
All right,
Okay,
so
let's
we're gonna
rotate
Who called
him.
you?
Watch the elbow. You got
Hey,
to
let me out of here.
And having any We'll see you
Get
over
out
here.
of here.
Huh?
I want out.
Yeah.
get her on there.
That way we're
Let
not
me out of here.
causing any kind of problem.
No.
So what we're gonna do is
I'm gonna go. Here I go.
All right, bye.
I'm gonna.
he's still connected to 15 liters non-rebreather.
Yeah, we do have that. Huh?
No, go ahead, you're fine.
Let me out. Let me out.
You gonna calm down for me?
No,
You
no.
gonna calm
Okay,
down?
ready?
Stop this.
Yeah,
now.
On your count.
1, 2,
I hit
3.
him. He
Check
ran
the
right out in
these
front of
step-offs
me.
in the net. Check
I hit
the
him.
make sure there's no
Anything?
penetration.
Nothing.
BTLS. Swelling, nothing was
Put
found.
him on the
Hey,
board
His
and move
spine
him
was
out of the way
intact.
of this
We're
woman.
gonna go ahead and roll him back on the count of 3.
She makes me
Ready?
tired.
1, 2,
Wait.
3.
I need a beer here.
Put him on the
Get
board.
out of here.
Okay,
Ready? I'm gonna
and
bring
up.
him down.
1, 2, 3.
Move up
1,
and
2,
take
3.
care of him. Let me
Okay.
I'm gonna take care of you first.
Sorry, buddy. All right, so we'll go ahead and the blocks are right next to the chrome there on his.
No, I know that.
Okay. So we're gonna go ahead and I'm just gonna recheck his airway, make sure he's breathing on me.
Still breathing.
All right.
Will you get rid of
Bleeding
all
is still
these
controlled
people?
with this
I don't like
4x4,
people
correct?
standing there looking at me.
Well, no look.
Looking at
I've got
him.
C-spine maintained with my knees. I'm gonna listen to his lung sounds. Are they?
Lungs are clear.
We've got lung sounds clear
Good
bilaterally.
spiders.
Where's the police?
All right, lung sounds are clear bilaterally. All right.
Go chase her down here again.
Go, 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 go. I got
Check his
this. I got
pupils.
this. Go.
Pearl.
Pupils
Hey,
are
come
pearl.
on here. Get out
Sir,
of
do you know what day today is? He is warm and dry. He is alert and oriented.
He's a little pale. He's alert and oriented.
All right. All right, so we're gonna go ahead. We've splinted his leg.
Well, I got
want to
two
get
very
rid-
good
get rid of all these
paramedics taking
people.
care of her. You got any problems, like medical
Yeah,
problems?
there we
you
go.
know
1,
about?
2, 3. I'll get his legs.
No, I'm fine.
You find no history of heart or anything like that, I need to worry
yeah.
about.
All right, so we have
What kind
abrasions
of
on
heart?
his hands, but they're not bleeding, right? They're just abrasions. There's no bleeding on his hands. We found we've got good PMS
Well,
prior
that's
to
your fault
boarding.
if I hit my
We've got a
Something
broken
right
femur,
here.
possible
police.
broken
Get the
femur.
police.
They got the
We
police
do
coming.
have a play
Hey,
test.
hey, boy, are you okay?
We have another.
breathing?
Ma'am, are you okay?
Is he
He
breathing?
is breathing.
All
Are you
right.
okay?
he's
all
We
right.
got him. He's under control.
What's the matter with him?
He's fine.
What happened to him?
We're not
He
sure.
ran right out in front of me.
All right, where'd he
I
hit
hit
you?
him, and he
Put her on some
rolled the
O2.
car,
All right.
and he landed right there.
Yeah.
Right
Put,
there.
put her on some
Right there.
O2.
Yeah, ma'am, let's
Where's the
let's get
ambulance?
some oxygen, okay?
Where's the
She's
ambulance?
obviously getting pretty excited.
Hey, let's put
Hey,
on O2.
hey.
It's over there.
Policeman, where are you?
Ma'am?
Please,
Here, come over here. Come over here.
All right, so we're going to go ahead and continue to... There we go. Ready?
Poor little guy.
All right, sorry about that. Yeah, right now. All right, so we're going to go ahead and tape him down to the board. He's completely immobilized. We have one person who is a little...
You gotta take care of him.
Well, I got two very good
Well,
You guys, anything else we need to know about you? Medical history
All
or
right.
anything?
no, I'm fine.
You don't have high blood pressure, asthma, or
No,
Of
anything?
course not.
Have you eaten today?
No.
No, have
Why
you eaten
should I
today?
eat?
Can you lift
I'm not
up the
hungry.
board some? Because
Okay.
this
I'm not hungry.
grass is really causing some problems. All right.
You just driving?
I
No
get in
place
the
to
car
go.
and I
Alright.
just drive. You know, I like to drive.
Oh,
I'm gonna check
jeez.
your pulse if you
That's a
don't
real
mind.
nice one,
See
isn't
how your
it?
pulse is doing.
My
That's
All right, so there was
That's
no
nice.
fluid leaking from the
Ears,
ears.
nose, and mouth.
No
Already
fluid
did
leaking from the
that.
mouth. All right.
Can I take your blood pressure?
Check tracheal deviation. No tracheal deviation.
No,
raccoon
I
eyes.
already did that.
We got
Good lung
pupils are
sounds.
closed, lung sounds are clear bilaterally.
They are
Still
clear now.
breathing adequately.
You work out.
No metal or tags.
Okay, buddy, go ahead. Squeeze my hand. Squeeze, squeeze, squeeze. Is he squeeze? Squeeze. Okay, can you wiggle your hands?
Yes.
We're in the back of the ambulance. Let's call the hospital, let them know that there's a 10-year-old right now.
Vitals on him first.
I have respirations of 18.
Respirations are 20.
Lung sounds are still clear bilaterally.
Clear bilaterally.
Respirations 18.
20.
20, and they're normal and adequate.
Yes.
All right, we've got cap refill, less than 2 seconds.
Less than 2 seconds.
He's still warm and dry.
Yep, and pale.
Impale.
What else we got? Let me check you out.
But his
120 over 70. 120 over 70.
100 over 72.
100 over 72.
pupils are pearl. All right, so I'm going to call med control and let him know we've got a 10-year-old male who was hit by a vehicle, moving vehicle, who has a possible flail chest. He's got abrasions on both hands. He's got a abrasion to the back of the head on the left side. A possible femur fracture. Vitals are 1. What is it?
Respirations 18, BP 100 over 72. Pulses were good,
Pulses
equal.
were present and equal in each
CNS was
extremity.
good.
He is
Negative
alert and oriented. He
JVD,
has good
flail
ALF too.
chest.
He's 15 on a GCS.
Yep.
Pulse ox is 98%.
Do I see any deformities here on the forearm, something like that?
Deformities. He's just got abrasions. Bleeding is being controlled to the back of the head.
Where's his parents?
We gotta find. We don't have his parents here. We'll get it soon.
Well, why don't you have his parents here? Didn't you call him?
Well, because we don't know where he lives at. You know who
Well, no, I don't know
he is?
who he
Well, how are we
is.
supposed to find him?
I'd ask him. Checked anything. We don't have
We're in
any
the
kind
back of the
TKO
ambulance,
to-
right?
Yep. We have nothing else found.
We're on our way. We gave an update. Let's give another update to the hospital. Let them know he's compensating. No big changes.
Give me your, let me see the vitals.
Okay.
All right, so I'm going to call med control again, let them know we have a 10-year-old male. We're en route to their facility. We've already called once. This is an update. No other injuries noted. No other, all of our interventions so far seem to be okay.
Respirations 20, 100 over palpation. Pulse is at 100.
He's warm and dry. He is a little bit pale now. Pulse is 100. He is still adequately perfusing. And we'll be at your facility now. Time.
This involved an auto accident with a female individual who hit approximately a 10-year-old boy. The female individual who was driving was hysterical, which tied up one of our crew members, while the other 2 of our crew worked on the 10-year-old individual. He had a flail chest, he had a femur fracture, some other bumps and abrasions, so we packaged him, put him on a backboard, and put him in the ambulance en route to the hospital. With someone who's driving around like that, or an adult who's driving, she ends up being very hysterical. You don't know what kind of behavioral responses is going to be coming from that individual. We can also see to where this might be a police problem, because this is going to be obviously a police investigation. We want to maintain her and the individual who was hit, because both of them are patients to us at the present time until we can make sure that she's okay. She might be exhibiting some other kind of abnormal behavior due to diabetic reaction or any kind of cardiac event. When there's 2 of us on the crew, we end up taking care of what we can, or who's the sickest at that present time, or who's going to be more of a situation that we have to maintain. We call for additional assistance, whether it's an engine company, additional ALS providers, and obviously in this situation, police would be a vital assistance to us. You deal with the resources that you have in hand, and you take care of the patients that you have in hand that are the worst or that you can do the best for. The IRECA conference was awesome for us. We were able to compete here at International because of what we've done at Virginia State. We're able to be first place at Virginia State, and as a result, Virginia Association of Volunteer Rescue Squads sponsored Loudon Rescue to come out here for us to compete internationally. It has really helped us because it allows us to see on a very broad exposure across the country and internationally what types of people are involved in EMS and what types of techniques they're using. So it was a major learning experience for us. With someone who's driving around like that, or an adult who's driving, she ends up being very hysterical. You don't know what kind of behavioral responses is going to be coming from that individual. We can also see to where this might be a police problem, because this is going to be obviously a police investigation. We want to maintain her and the individual who was hit, because both of them are patients to us at the present time until we can make sure that she's okay. She might be exhibiting some other kind of abnormal behavior due to diabetic reaction or any kind of cardiac event. When there's two of us on the crew, we end up taking care of what we can, or who's the sickest at that present time, or who's going to be more of a situation that we have to maintain. We call for additional assistance, whether it's an engine company, additional ALS providers, and obviously in this situation, police would be a vital assistance to us. You deal with the resources that you have in hand, and you take care of the patients that you have in hand that are the worst, or that you